options with no weight gain. Birth control options with no weight gain is something most women look for when trying to avoid pregnancy. As women age and are still in their childbearing years, their metabolism seems to slow down, making it easier to gain weight. It is a never-ending battle for women to maintain a healthy and attractive weight. Women need birth control options that are effective and do not make them gain weight. In general, non-hormonal birth control options such as diaphragms, condoms, or cervical caps are good options if you do not want to gain weight. There are other birth control options with no weight gain available, and we will delve into those soon. In this video, you will learn 8 birth control options that do not cause weight gain. Before we move on, please subscribe to our channel and be sure to like and share the video.
This video is partially sponsored by DelvixGarden.com, your source for high-quality food supplements and personal care products at low prices. This company has a range of premium products for your health, beauty, and personal care, including organic pine pollen, ceremonial-grade matcha, medicinal herbs, hair dye shampoo, and plant-based protein for weight loss. There are links in the description. Kindly visit their store and use the coupon code FIRST20% to get 20% discount on your first order.
Here are 8 birth control options. 1. Birth control pills. Birth control pills are taken by mouth to prevent pregnancy and are also called oral contraceptives. Some birth control pills will change the lining of the uterus temporarily, which reduces the chances of a fertilized egg being implanted, while others actually prevent the ovaries from releasing eggs. Birth control pills can be a combination pill which contains synthetic form of both progesterone and estrogen, or progestin-only pills, synthetic progesterone, without estrogen. Women need to have a choice as to which type of pill to use. If a woman has a history of certain diseases, like high blood pressure or cardiovascular disease, it has been advised to take the progestin-only pill. On the other hand, if a woman has had lupus or breast cancer, it has been advised to avoid the progestin-only pill. Some women may gain a minimal amount of weight due to fluid retention, not extra fat. However, this will go away within a couple of months. Originally, birth control pills contained very high levels of estrogen, which did cause weight gain. This is no longer the case since the amount of estrogen in birth control pills has been drastically reduced. There were 44 studies reviewed that showed there was no evidence of birth control pills causing women to gain weight. 2. Vaginal ring. The vaginal ring is a flexible, small piece of plastic that provides birth control. It is inserted into the vagina once a month and left in for 3 weeks. It is taken out for the 4th week, and then you start over again using a new ring. This form of birth control requires a prescription and is 91% effective with typical use. The vaginal ring contains a combination of progestin and estrogen. Progestin can make you feel a sense of fullness since it can cause water retention and bloating, but this feeling should not be significant and only last a few days while your body adjusts to the vaginal ring. 3. Patch. The patch is a birth control option that is a hormonal method. It contains estrogen and progesterone like the pill. However, it does not require a daily routine. It is a small piece of plastic that sticks to your arm, buttocks, stomach, or torso and is replaced on a weekly basis. The patch is a more convenient birth control option that shares many of the same benefits as the pill. Some women experience skin reactions, spotting, headaches, bloating, and breast tenderness, which are mainly the same side effects of the pill. 4. IUD. An IUD is an intrauterine device that is inserted into the uterus by your doctor. This device is T-shaped, and you must choose between one that has synthetic hormones or one that contains copper. The IUD is a very effective birth control option, and pregnancy only occurs in less than 1 out of every 100 women who use this form of birth control. If the copper IUD is inserted within 5 days of unprotected sex, it can be used as an emergency contraceptive. The IUD is reversible, and when a woman decides she wants to become pregnant, it can be removed. It is said that the copper IUD can cause heavier bleeding, while those that contain hormones tend to make a woman's menstrual cycle lighter. 5. Condoms. Condoms are available for both men and women, are very popular. They are the only birth control option that prevents pregnancy and diseases and infections. Condoms can be used with spermicide, foam, jelly, or cream to add more protection. They are an inexpensive birth control option and do not require a prescription or a doctor's visit. 6. Sponge. The sponge is a birth control option that is a soft foam coated with spermicide. It resembles a donut and covers the cervix once it is inserted into the vagina. The sponge, as well as the diaphragm and cervical cap, are non-hormonal birth control options which are great for women with medical conditions such as cancer, where it's unsafe to use hormones. Unlike the diaphragm and cervical cap, you can purchase the sponge over the counter and skip the doctor's visit. 7. Diaphragm. The diaphragm is a flexible cup that is placed in the vagina to block sperm from entering into the uterus. This device is most effective when used in conjunction with spermicide. Your doctor can fit you for a diaphragm, and you should have it replaced yearly. You should occasionally inspect your diaphragm to ensure there are no tears, holes, or thinning of the latex. This device can be inserted up to 6 hours before sex and should never be left in more than 24 hours. 8. Cervical cap. The cervical cap is a very similar device to this diaphragm and needs to be fitted by a healthcare professional. It is also most effective when used with spermicide. The cervical cap is placed into the vagina where it keeps the sperm from entering the cervix. It should be replaced yearly. The cervical cap should never stay inserted more than 48 hours. Leaving it in for an excessive amount of time could cause toxic shock syndrome. You have several birth control options to help you avoid pregnancy that do not cause weight gain. When deciding on which method to use, you should consider your overall health, any medications or alternative remedies that may interact with hormones, as well as your personal comfort. Thank you for staying with us until the end. Please like and share the video, as well as press the bell icon to receive new notifications. Remember, subscribe to our channel.